सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। नमो नमः श्री सिद्धिविनायक नमो नमः अष्टविनायक नमो नमः गणपति बप्पा मोरया।
गणपतये नमो नमः श्री सिद्धिविनायक नमो नमः अष्टविनायक नमो नमः गणपति बप्पा मोरया।
History all yours.
Thank you so much, ma'am. Today we are having very interesting topic, which is resistance exercise. Resistance exercise with normal exercises and in with the combination of heavy exercises, or we can say the plan to workout. Now, in this workout plan, in this exercise plan, we have basically three sets of exercises. First set is related to the person who are not able to do minimum level of exercises. Second level for moderate workout person who can do limited walk, who can do stair climbing easily. And third is for advanced exercise.
Are your lungs healthy? Let's find out. When I say go,
I'm not going to discuss here grade 3 exercises or the exercises which are for heavy workout personalities. We just do grade 1 and grade 2 exercises. These exercises are basically related to resistance exercises. Resistance exercises are also known as heavy strength exercise, or we can say this exercise which put a resistance on your muscles to resist the strength level, to increase the strength level or resist the particular movement. We will start with the cervical spine and the shoulders so we can understand the more mechanics of short muscles, more mechanics of small muscles, by which we will move to the lower limb and the back muscles in next session. Now, in cervical exercises and in shoulder exercises, first we will do all type of isometric and basic exercises which we have done in previous sessions. After the exercises, the basic exercise module will follow the resistance exercise. In resistance exercise, we have to follow two regimes. I will share the screen. This is the sample of resistance exercise which is related to the TheraBand or resistant band exercise for leg squatting, for pelvic tilting, for deadlift. This is a assisted exercise pattern for lower limb and back. Today we will see non-assisted movement of all the muscles in upper limb, including cervical and shoulder region. Now in cervical region, when we do all the stretching, basic stretches, both the sides, forward and backward, it's for the normal cervical spondylosis or normal neck pain and strain conditions. After that, doing gentle stretching or warm up of the neck, we have to do MET or resistance exercises. There is a little difference between MET, muscle energy techniques, and resistance exercise. So we will move first with the basic resistance exercise of the cervical spine. These are very important exercises for these are very important exercises for the mid cervical pain. First, I will tell you the condition and their exercises one by one, so it will be easy for you all to understand the pattern of the exercises which we are going to do. First, for the mid back cervical pain or for mid area cervical pain, we will do exercise in a pattern which we will give resistance from the both sides. First, we will do side bend like this, and we have to hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After the 10 second, just have to give a gentle pressure towards opposite side to your hand. Opposite side to your hand. You have to understand this mechanics. This is a muscle energy technique mechanics. It will give you instant pain relief. We are doing simple side movement. After the simple side movement, hold for 10 seconds. And after 10 seconds, you just have to move your neck like this a little bit and give pressure from your hand, antagonist pressure. Pressure from head to the palm and from palm to the head and hold it for 10 seconds. Again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then leave it gently and do it a neutral position. Now, what we'll do in this exercise, this is a muscle energy channel activation exercise. You will do side bend for gentle stretching. This will stretch your side neck muscles. After the side neck muscle stretching, you will give a gentle resistance to your muscles from agonist from opposite side. After the giving pressure to opposite side, it will spontaneously activate your deep channels of your neck muscle, which will enhance the level of mechanics of correction of your muscles. So your muscle automatically get corrected. If you are having neck tilting, if you are having pain in your center of your cervical spine, then this will get cured. But remember, in this, you have to do both the sides equally. If you are going to do 3 times on this side, then 3 times on this side. This is 3 to 5 mechanics. This is based on muscle energy technique, osteopathic mechanics, which we can say. So we will do on opposite side. Just place your hand like this. The hand placement, stretch, and the hold time is very important in this exercise. Stretch gently, hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then stop and give gentle resistance. I will tell you the resistance mechanics. Like this, you have to give from your head, and like this, you have to give from your head, from your hand. Sorry. You don't need to move anything. It's an isometric resistance program. Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then release. The placement of the hands is this, not this and this. This will stretch your other muscle, which we are not going to stretch. First is this side movement, second is this side movement. This is MET, muscle energy technique, certified or registered under the all techniques of the osteopathic mechanics. Now, after the side stretch, first we have to do side stretch for cervical mechanics because in some cases we see vertigo and nauseatic movement and nauseatic feeling in cervical exercises. So These both movements are really safe, so you can do 3 to 5 repetition at one time in a day. Next is SCM or side stretch. We have to see the axis of the neck. Axis of the neck is very important because if you see the axis of the neck, if you check the axis of the neck, then you may judge properly the angle of the exercise in a correct way. First, we have done side bend. There are four movements, two of sides, in front and in back. One is oblique movement. One is oblique movement. Yes, you have to stretch it obliquely. Yes, it's not side, it's between side and front movement. This is my side and this is my front. You can see this is like this. You can put your hands like this and you can see the angle of side bend. It will give relief to your lower cervical and your mid back pain, especially the pain which is coming on your shoulder blade, like this. Side stretch. One, two, three, 4, 5, 6, 7, 8, 9, 10. After the side stretch, hold it for 10 seconds. Give the against pressure. This is a resistance exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very much effective for headaches and vertigo. You just have to maintain the side movement correctly. Again, on the opposite side, first you have to check the side. Check the side. Yes, this is a completely side movement. This is front movement, and this is between movement. This part will stretch. Can feel the stretch over here. This part will stretch, and especially if you are doing as a demo, then please do it on both sides. Otherwise, your alignment get disturbed for 1 or 2 hours. You may get pain for some time. So you have to do. I'll also show on the both sides. Stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then after the 10 seconds, just have to give gentle pressure, head to hand and hand to head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and gentle release. You can do side movement or releasing techniques which uh, will give gentle relief to your neck. This is the second resistance exercise technique of the cervical spine. Now, the third technique which will give resist to your neck muscle is side movement. After doing side movement, just do side movement simply. First, see the exercise, then repeat it because if you're not focusing on the screen, then you are not able to do side stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then wait and give it a gentle pressure like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is ultimate exercises for the patients who are having cervical to neck, cervical to neck, and neck to ear pain. In short, sides of the neck pain. We're doing side movement. After the side movement, we will wait for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then pressure from your same side hand. Pressure should be on the same side of your hand. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. On the both sides. If the range is restricted in some cases, you can do like this only. If the neck is not going towards the right completely or towards the left completely, then you can stop in between also. The whatever the range is, you can do and stop in between and do like this. If you want to get more cautious for and more careful for these exercises, then you can do in breaks also. Breaks in like don't do full movement, just do half movement like this, like in side movement, like in side bending or in turning movement also. You can start with this in first week. So these were the basic movement for the cervical spine, including all the conditions, especially contraindicated. Yes, you may get hurt some on the sides of the muscles and soreness also, but it is very normal to get sore about 1 and 1.5 hour. But METs are really helpful. You may get soreness, but you will get relief from the pain instantly. Pain will gone instantly within seconds of these exercises. These were the set program for muscle energy techniques of the neck area, which covered in osteopathic mechanics. Now, in the general stretching mechanics, you can do you can make a circle of stretch with 2 2 seconds hold. You can make a circle of stretch with 2 2 seconds hold. First, I will show you how to do this exercise. Then you can repeat. First, you have to understand the mechanics of the exercise. The movements are the same. First movement is this one and two. One, two. 1 2 is in the form of seconds, like clock. Not 1 2. It's 1 2 1 2. It's not like that. This movement, it got stretched, then you can begin your counting. One, two, one, two, one, two, one, two, one, two, and one, two. This is a complete cycle of the baseline stretch of the neck muscles. It will cure your cervical spondylosis. It will cure your cervical listhesis. It will correct your neck mechanics. Again, I'll explain you. Yes, you can do in standing also. Standing is also fine. But if you're getting any problem in your legs and back, then you can do in sitting position also. Again, I'll explain you. First, we'll start with the side bend. Side bend complete. After the completion of the side bend, I will start my counting. One, two. It was on the left. Complete right. Then one, two. It's on right. Now I will turn my head. One, two. Hold for two. Then neutral. Then again. One, two. Then neutral. Then side. One, two. Then center. Then one, two. It's better if you get a neutral position in between. The starting point will the same from the same pattern. You will start the exercise in all the motion. Again, this is 3 to 5 cyclic movement in this. 3 to 5 times we have to do. 3 to 5 cycles you have to do. This is the complete regime of the cervical regime exercises. If you are going to do cervical isometric basic movement, this MET resistance exercise and this is cyclic stretch, then you will completely recover your cervical problems and you'll get completely cured of the cervical problem, but you have to do mechanically proper manner and in sequence. You should be specific. If you're having any problem, then you can consult. After a consultation, you can start the exercises. Exercises are all in a very easy form. Now, there are some chin tucks activity which you can do. Remember for the chin tucks are not safe for everyone. I'll just explain you the mechanics of the chin tuck. If you get any problem in doing chin tucks and don't do, just ask and consult before doing these exercises. What is the chin tuck? Chin tuck is especially for those patients who are having pain in their occiput region, in their upper head, or we can say the lower head, upper cervical region. This area, if you are having pain or sensation loss, or we can say tingling sensation on this area, and for those persons, chin tucks are very useful. But we have to do chin tuck in a correct manner. So I will tell you the easiest method of the chin tuck, which is just straighten your shoulders, straighten your neck, and see your nose. First, you have to listen the instruction carefully. Just straighten your shoulders, straighten your neck, see your nose. After seeing your nose, set the angle of eyes and close your eyes and do your chin tuck with the help of your finger like this and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, then release. What is the mechanics of eyes? Eyes will concentrate on your nose and nose will align your chin automatically. When you will align your chin automatically, when you get alignment of your chin, then your chin and the cervical atlas axis will go in a smooth way of the movement. Again, I'll explain you. Straighten your neck, straighten your shoulder. Just see your nose with the both eyes. It's better if you do without the specs. If you're having any visual problems, then without the specs, it will go correctly because nose is too near to the eyes. Just see the nose. After seeing the nose, close your eyes. On that point, you have to remain for 1 or 2 seconds. It means your eyeballs are not moving or not going anywhere. It's inside and concentrating on your nose only. After that, just put your finger on your chin and just give a simple tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then release. It's so easy chin tuck ever. You can do in easy manner with concentrating on your nose with your eyeballs. After doing chin tuck, you can do icing or hot fomentation on your neck region because it's the exercises of Atlas. It's a C1 cervical junction from your head, occiput bone. If you are having any neck shifting, if you are having any sort of tilting of neck, then you may get relief with this chin tuck exercises. Again, if you are having vertigo, if you are having nauseatic movements with these exercises or increase in any sort of pain, then you are completely contraindicated for this exercises without consultation from your physician or your orthopedician. So, what we have done all the resistance exercises, stretch exercises, and chin tuck exercise of the neck. Now, that was the complete regime for the cervical spine. Now, we will do exercise of the shoulder regime in combination of the cervical spine. In combination means if you are having any problem in shoulder, means you have to do shoulder exercises plus cervical exercises. And if you are having any problem in cervical spine only, then also you have to do shoulder strengthening program because they both are connected. So if you are going to do all the cervical exercises and you're not getting relief from so many years, it means you are doing it incorrectly and you are not strengthening your shoulder areas with the cervical spine because they both are interlinked. They both are interlinked, so you have to do shoulder strengthening programs also. Now, in shoulder strengthening program, you can do all type of movement like rotation and outwards stretch and so many of the exercises, combination of the shoulder regime. But resistance exercises or MET exercises are little bit different. Again, they will give you instant relief. They are helpful for giving relief in just 30 to 60 seconds. So first we will start in a simple way with the shoulder. Just put your opposite Hand opposite palm on your shoulder. First, check the movement of your shoulder. If it is moving correctly or not. If it is not moving correctly, then this exercise is contraindicated. You cannot do this exercise. Just have to check the movement of the shoulder. Shoulder is going inwards, outwards, or not. Just inward, outward, not whole movement. My hand is relaxed. I will show you from the different angle. It will be easy for you to see from this angle. Now you can see my hand. This is shoulder movement. My hand in this position. I am sitting on the floor. I am on the floor. This movement will go upwards, upwards, in front, upwards. It's more easy if you understand in front. It is in front. You have to do a gentle movement in front. We will start with the right shoulder. Just do right shoulder upward movement. One, two, three, four, five, six, seven, 8, 9, 10. Hold on. Place your left hand on shoulder. Just give a gentle pressure to shoulder, from hand to shoulder, from shoulder to hand. Yes, like this. Very good. One, two, three, 4, 5, 6, 7, 8, 9, 10. Leave it. This is MET technique or resistance technique of the shoulder joint in front movement. Next is just do left shoulder in front. One, two. Don't turn your chest. It's not a trunk movement. It's only a shoulder movement. You have to be more specific for the movements because we are not going to do associate movement. Associate movement may get injured your or overstretch your muscles. It's like that only. One, two, three, 4, 5, 6, 7, 8, 9, 10. Hold. Place your right hand. Yes. Press it. One, two, three, 4, 5, 6, 7, 8, 9, 10. Then release. Very good. This is a special designed exercise for the patients who are having frozen shoulder, for the patients who are having adhesive capsulitis, who are having any problem in the capsule of the shoulder in front. Again, we will do next step of this exercise. Next is backward movement exercise. Same mechanics is same, pattern is same. You just have to do it in a sequence form. Again, you can do like this also. You can do in a hanging position also because the cavity is fixed. If you are going to do like in hanging or in the supportive position, the both conditions are same. But don't do in this condition. This is not feasible and not comfortable position for the resistance exercise. You can do it on chair also. Just place your hand like this. Just give a back movement to the shoulder. I'll explain the back movement like this. Yes. Your chest, front part of the chest will retract. Front part of the chest will retract. This is the identification or this is the marking for this muscle. Stretch. One, two, three, 4, 5, 6, 7, 8, 9, 10. Hold. Place your hand on back. Then give again back movement from your shoulder and from hand to your shoulder. One, two, three, 4, 5, 6, 7, 8, 9, 10. This is a both side. Sorry. This is a both side movement. From left shoulder, retract. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You have to do on the both sides same. Now, with the next movement, you have to stretch your shoulder side muscles like this. I'll explain the pattern first. This is a side swing movement of the shoulder. Now, if you do a normal stretch or a normal upward movement of your arm, then this will go like this. In this swing pattern, you just have to give a simple resistance above your elbow. This is from 1 to 10 times. You don't need to stop in this exercise. It's better if you'll do in standing. This component, this part, abductor part of the shoulder, deltoid part of the shoulder will stretch in this exercise. The deltoid basic component is related with the cervical and the shoulder region itself. Again, you will see the movement. Just place your hand, opposite hand, above the elbow. This is agonist pressure, antagonist pressure. Pressure is from the hand to the elbow. Yes, like this. 3 times on each side. Each side 10 times. That was the second movement for the shoulder exercise, for the shoulder resistance regime. First was front and back with the right first or the left first. Then on the second side, front and back. Then the swing movement. Swing movement is a little bit different because we are going to stretch, resist so many muscles at the same time. In this mechanics, you will stretch your arm muscles, you will stretch, and this is like in swing pattern. The wrist is free. The wrist is free. That was the second pattern for the shoulder exercise, shoulder resistance exercise. Now, the third pattern is ULTT stretch. ULTT is an upper limb tension test. ULTT is a medical term which we do in a test form at our clinic. But again, at the same time, ULTT is also a type of stretching exercise. So we have combined this stretching exercise in the shoulder and the cervical regime together. So you have to maintain your arm like this. I hope everyone can see. You have to maintain your arm like this. The level of and the shoulder is same. The level of the arm and the shoulder is same. It's not dropped. It's not much elevated. It's the same level as the shoulder is. After doing this movement, you have to stretch your wrist like this and backwards and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then relax then leave it. Again, the opposite side, maintain your arm, stretch. One, two, three, four, five, six, seven, 8, 9, 10. That was for cervical and shoulder regime, both at the same time. Now we will see the combined exercise of cervical and shoulder. That was for the shoulder, first regime. Second regime was with the individual shoulder, not for the cervical. Third pattern is included, or we can say it's a cross pattern. It's a cross pattern of exercise. In this cross pattern of exercise, you can do stretch with both of your arms with neck. You have to stretch your arms like this. After the stretching of your arms should get completely stretched outwards. It is very, very important to stretch your arm completely outwards. It's not sloped arm, it's not loosened arm, it is tight and stretched outwards. Yes, like this. After the stretch, hold it for 10 seconds. One, two, three, 4, 5, 6, 7, 8, 9, 10. Hold. Then bend your neck. One, two, three, 4, 5, 6, 7, 8, 9, 10. Neutralize your neck and release your arm. This is a combination of shoulder plus cervical spine. If you are having any problem in forward neck bending, then do it in a gentle way, do it in a semi flexion way, not in a complete flexion way. You can start with the semi flexion like this also. But first we have to stretch your arms. What is the mechanics behind this exercise? If you will stretch your arms completely, then a deltoid, triceps, biceps, and the back side of the shoulder, which is related to the shoulder blade, will get stretched, and your neck will stimulate all the fibers at a single time. This is a very important exercise for mid back pain, for the pain in elbows, for the pain at the upper cervical region. These are the indications for this exercise. Like this exercises, like this simple set of exercise. Next exercise is related to the pectoral pain, the pain which is coming in front of your chest due to any reason or any pathology in shoulder or in neck. Not is related to your chest condition. It is not related to your chest pain or any heart or any internal organ pain. It is not related to that. It is only related to cervical and shoulder pain. It's a stretch only. This is not a curative intent for any pain of chest, especially contraindicated for any angina patients or any patients who are having any cardiac history. So you have to stretch in front upwards, hold it for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then utilize your neck, release your arm. Like in front direction, you have to stretch it properly, and this should be connected. The palm should be connected or in contact with each other. Because if you do like this or this, you will get posterior deltoid and get pain in the back. Again, I'll tell you, explain you. Stretch it. Stretch it fully. One, two, three, 4, 5, 6, 7, 8, 9, 10. Then backward movement. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Neutralize. Then release your shoulder. If we will talk about the data, 100 in out of 100, 76 patients get relief from these all exercises in a correct way after the basic simple stretches and warm up exercises. And hopefully, we will do some more research on these exercises to make it more effective. We are doing so many trials on these exercises which are combined to the cervical and the shoulder regime. So that was it for today. So any questions you may ask if you have any queries.